Amblyopia, or lazy eye, is the loss of one's eye's ability to see details. It is the most common cause of vision problems in children. Amblyopia occurs when the nerve pathway from one eye to the brain does not develop during childhood. This occurs because the abnormal eye sends a blurred image or the wrong image to the brain. This confuses the brain, and the brain may learn to ignore the image from the weaker eye. Strabismus is the most common cause of amblyopia. There is often a family history of this condition. The term lazy eye refers to amblyopia, which often occurs along with strabismus. However, amblyopia can occur without strabismus, and people can have strabismus without amblyopia. Other causes include childhood cataracts, farsightedness, nearsightedness, or astigmatism, especially if it is greater in one eye. Eyes that turn in or out, eyes that do not appear to work together, the inability to judge depth correctly, poor vision in one eye. Amblyopia is usually easily diagnosed with a complete examination of the eyes. Special tests are usually not needed. First, any eye condition that is causing poor vision in the amblyopic eye, such as cataracts, needs to be corrected. Children with refractive error, nearsightedness, farsightedness, or astigmatism will need glasses. Next, a patch is placed on the normal eye. This forces the brain to recognize the image from the eye with amblyopia. Sometimes drops are used to blur the vision of the normal eye instead of putting a patch on it. Children whose vision will not fully recover and those with only a good eye due to any disorder should wear glasses with protective polycarbonate lenses. Polycarbonate glasses are shatter and scratch resistant. For achieving the best results in amblyopia therapy, total visual deprivation of the stronger eye is often recommended. For this reason, eye patches that adhere to the skin around the eye are most effective. Strap-on, pirate patches, and patches worn over glasses are less effective and only occasionally recommended. If a child is resistant to patching therapy, atropine, eye drops, may be helpful in certain conditions. Atropine is instilled into the dominant eye, creating a temporary blurring effect which may allow the child to use the other eye with the amblyopia, thus patching without using a patch. The pediatric ophthalmologist will prescribe the appropriate number of hours that the patch should be worn each day. While undergoing patching or atropine eye drop therapy, it is critical that your child return for a vision check at the recommended time intervals. This is to safeguard against the development of amblyopia in the eye being patched. Generally, the younger the child, the quicker the desired results are obtained with amblyopia therapy. After about age 8 to 9 years, the benefit of patching or atropine therapy is questionable. It is not uncommon that children with amblyopia will refuse to wear the patch and remove it when left unsupervised. Patching should commence during a time when you can devote all of your attention to your child. Typically, the first few days are the most difficult. Keep your child occupied with games or television when wearing the patch. If your child removes the patch, promptly replace it. Let your child know that you are the boss. Bribery may sometimes be necessary. In some younger children, the use of socks over the hands taped to the wrist may be required. Sometimes elbow splints are needed to prevent the child from removing the patch. Children who get treated before age 5 will usually recover almost completely normal vision, although they may continue to have problems with depth perception. Delaying treatment can result in permanent vision problems. After age 10, only a partial recovery of vision can be expected. Call for an appointment with your healthcare provider or ophthalmologist if you suspect a vision problem in a young child.